an interpretation globe at the bottom and select one of those. If you would like, you can also change how your name appears by clicking on the participants button, hovering over your name, clicking more, and then you can rename yourself if you like. And just for reference, you can find all the information that we'll be talking about today on our website at kingcounty.gov/BOH for Board of Health. So please use that as a reference today and later. And with that, I'm not seeing any questions. So is there anything else, Marielle or anyone else that I should say about the interpretation rooms? Okay, I'm going to take that as a no and hand it over to our board chair, Joe McDermott.
Thank you so much, Joy. As we start today, the very beginning of our meeting, I'd like to acknowledge that we're on the traditional land of the Puget Salish peoples, past and present. We thank these caretakers of the land who have lived here and continue to live here since time immemorial. And I'd also like to acknowledge the many urban Indians in King County who have brought their cultural ways of life here and greatly enrich our community. I share this very same land acknowledgement at the beginning of every Board of Health meeting. In fact, the image you see on the screen right now comes from the website Native Land Digital. And on this site, you can enter your zip code and learn which nations call your particular area home. And I'd encourage you to open the map from the link or type in the link. If the link doesn't work, the link should work. And share in the chat which nations have connections to the land you are on today. I want to thank you as we begin also for your interest in the work of the King County Board of Health and even possibly joining us. We appreciate your willingness to share your time and expertise to promote and support the health of King County residents. I come from the old school, Joy, so I sat in classrooms with film strips. So I want to say bong when it's time to advance to the next slide. Bong. Great. And to then introduce myself, I'm Joe McDermott, and I have the honor of serving as the chair of the King County Board of Health. This is my third year in the role as chair, but I've served on the board for just over a decade now. And I serve on the board by virtue of being a King County Council member. I happen to represent District H, which includes Tukwila, Berrien, Vashon, North Highline, including White Center, and parts of Seattle from the Chinatown International District, Capitol Hill, First Hill, in downtown through West Seattle. But what's more important today is the work of the Board of Health itself. I also get to welcome you to today's open house about expanding the Board of Health and the process for people interested in joining us. Our goal is to share with you about the board's work, what being a board member would entail, and the application process. And today I'm joined by Dennis Worsham, Matias Venezuela, and Joy Carpine Kazanti. And if the three of them would take a minute to introduce yourselves.
All right, thank you, Joe. Welcome everyone. We're so glad to have you here and to join us on a beautiful Saturday afternoon and to show your interest in learning more about our Board of Health and what it does here in our community to protect and promote the health of our citizens and residents. I'm Dennis Worsham. I'm the interim director for Public Health Seattle King County. We're the local health department for the whole county, and it's just such an honor to be here and to answer any questions or things that might come up during the meeting. But our role as public health is really to improve our population's health, sustain population health, and look at ways to create well-being for all people who live and recreate and play and worship here. All right, I'll hand it over to Matias.
Great. Well, good afternoon. My name is Matias Valenzuela, he, him pronouns. I am the director of the Office of Equity and Community Partnerships of Public Health, Seattle King County. I have been with the county for over 20 years. I'm just very proud to be part of the organization and King County government more generally. And I have to say, I'm just very inspired too to see all the participants today to be here and join us on this beautiful Saturday afternoon. So thank you, and really happy to be here. I will turn it over to Joy.
Hello, I'm Joy Carpine-Kazanti, and I am a Board of Health Administrator. I'm filling in for 6 months. Some of you may be familiar with Susie Levy, who is on parental leave. So I'll be here until almost the end of the year, and I'll be helping with this Board of Health expansion. Thank you.
Thank you to each of you. And we will welcome your questions in the chat field or by raising your hand throughout our conversation. We'd like it to be conversational and not so much us simply talking to you. So if I can go to slide 6, bong. While the Board of Health may not be as well known as other governmental bodies, it's one that has a very specific role here in King County. I'm sorry, am I jumping the gun? Matthias, is this supposed to be you? Yeah.
Yes.
I'm sorry.
Board Chair, yes, I can take this one.
Please go ahead.
Okay, well, great. Well, thank you. And I think it's so significant that one of the first slides too is starting with our declaration of racism as a public health crisis. About 2 years ago, we were at the height of the COVID-19 pandemic. And as people recall, our streets were filled with also protesters and demands of institutions, governments, and society as a whole, needing to address not just the pandemic, of course, but actually the ongoing challenge of racism in our community, and specifically in the King County region. We had many organizations really fighting for the lives of Black communities here in our region, and many other organizations that, especially Black and Brown and Indigenous organizations. And they were, we received a lot of letters and demands. Public Health did, King County Government Council, King County Council did as well. And really the county responded to those demands. Public Health, King County Government, King County Council, and the Board of Health itself to making some commitments around this and making racism as a public health crisis a priority and creating a declaration. We have already been more than 15 years now doing the equity and social justice work in King County, but I think this is extremely important, just the more explicit focus on Black, Indigenous, people of color. And what makes this very different too is I think it's a very action oriented and especially highlighting our policies and our budget investments. So I think it's just a really exciting, important time for the Board of Health. And I think during the rest of today, as you hear from our leaders here, you will see how also this declaration and commitment is shaping the new direction of the Board of Health. So thank you.
I see we have a question about what does the Board of Health do? And we are going to get to that in just a second. So thanks for the question.
In fact, slide 6, there we go, is about what the work we do. We may not be as well known as other governmental bodies or decision makers in King County, but we have a very specific role in King County and in promoting public health. Our local Board of Health, as well as every other one that covers the entire state, is created by state law. And under state law, the board is to set countywide public health policy, enact and enforce local public health regulations, enforce state public health laws, prevent the spread of infectious diseases, and establish fees and fee schedules for certain licenses and permits, such as food permits for restaurants, and even inspecting swimming pools. I'm particularly proud of our board's longtime commitment to progressive public health policy and actually being a national leader in many of those policy areas. Next slide, please. What do we do? What are some of the tools we have to do the work I just described? We have three types of legislation that the board can adopt, and as we're adopting it, amend it, and over time, amend and pass it. The first type of legislation is a rule and regulation that really does have the force of law. In fact, it becomes the Board of Health code. We have our own code. We don't follow and are bound by per se the county code or the state law. We have our own Board of Health code where our rules and regulations exist as a flow of documents. And an example of the board using this authority in some of the progressive policy I mentioned is banning tobacco advertising. Like for those of you who remember the Marlboro Man from the Kingdom and now T-Mobile Park, and menu labeling in restaurants. In 2013, the board created a secure medicine return program. The program provided King County residents a way to get old, expired, or unwanted medicines out of the house safely and paid for by pharmaceutical companies. And it was one of the very first programs in the country. I believe it was us and Oakland who adopted the first programs. And then earlier this year, the board actually removed a requirement we'd put in place some 30 years earlier to require bicycle helmets when riding a bicycle. And we did this because after over a year of study and reflection on the fact that the laws were being enforced unequally, disproportionately, with more stops and more citations given to people experiencing homelessness and BIPOC riders. Moving on to the next type of legislation, the second type are resolutions. And these are policy statements the board makes, usually to express support for a program, project, or policy. And examples would include expressing our support for efforts to prevent gun violence and to endorse efforts to improve environmental health. And then the last type would be guidelines and recommendations. And this is where, from our expertise or the expertise we can assemble, we provide guidance to other jurisdictions or entities. Think the 39 cities across King County, where particularly some of the smaller cities may not have the staff, the particular knowledge, the bandwidth to come up with all of the health effects of zoning or housing policies. We will come up with a guideline and recommendation in some of those areas, such as healthy housing, and by adopting them, have them available to local jurisdictions as guidance for how they might inform their work. And then lastly, I would note some advocacy. It's a rather important action that the board uses our influence and maybe doesn't fall particularly under our own authority, but we use our advocacy with others. Often the board will write letters or might submit an op-ed to advocate for or educate about a public health matter. We might quite often will be lobbying the legislature using our advocacy in Olympia around state policy or policies that will affect local boards. Next slide, please. And as Matthias has already addressed, that one thing that really does unite the board and King County is a commitment to address racism as a public health crisis. The board, as well as the public health director and the executive Constantine, have made statements clearly and adopted legislation centering our work around recognizing racism as a public health crisis. And when the board did this in June of 2020, it passed a resolution which commits to 4 specific actions, ongoing actions, including declaring racism as a public health crisis, stating our support for a public health approach to address institutional and systemic racism, committing the board to review, revise, and conduct our work using a racial justice and equity lens, and committing the board members to ongoing work on race and equity. A small piece of that work is earlier this year, we did a retreat on the social determinants of health, further informing ourselves, because even before we remake and reconstitute the board, we have a mix of elected officials and health professionals who come to the board with varying levels of knowledge as we arrive at the table. So a really productive retreat in trying to have common ground for all of us. And all of this work includes being with and being responsive to communities impacted by racism. The board works closely with the Department of Public Health and often draws on their experience, expertise, and knowledge. Dennis, would you like to say a few more words about how the board and the Department of Public Health work together?
Yeah, thank you. As our board chair, McDermott, just walked through kind of the roles and responsibilities and all of the tools that are used to be able to promote good health in our community and really to keep people safe. And we do this all with, as been mentioned a couple of times, is really with our attention to racism. And we know that racism has impacts on health of our community. We have in public health, we've got a department of about 1,800 employees, and it covers the span of, from chronic conditions and chronic disease to infectious diseases like COVID that we're addressing now, and our environmental health protections to keep our environmental safe, and in our restaurant inspections and a variety of other functions we have within public health. We look at the health of our community and look at different policies or practices that we can do to really help promote good health and also just to keep our community safe. We do this oftentimes working closely with community and bringing community voice and lived experience to help influence what we should be doing to improve the health and the safety for everyone from a health lens in public health. We oftentimes will raise those up working very closely with the Board of Health, and the Board of Health will take an action oftentimes as Councilmember McDermott said, that either address a rule or a regulation to help support that way to improve health, or create a resolution or develop guidelines or recommendations, or there may be legislative policy that we are trying to move forward to really, again, promote the health and protect our communities so that everyone has a good experience of long lives, healthy lives. And we really do that, again, through the work both in partnership with community and with key stakeholders and partners across King County. And the Board of Health is a really strong partner with us in this, and oftentimes our legislative group that we work very closely with in helping to promote it. So we'll do presentations with the Board of Health. We'll make recommendations of policies that we think are model policies that have been mentioned already, whether that was from reducing or eliminating the bike helmet law, or as we looked at menu labeling in order to really address chronic conditions around diabetes and heart disease and other leading causes of death. All of those, we use the Board of Health as our mechanism in order to be able to move and promote the health, or in this situation is actually enact law to help us move in a better way. So it's a really good partnership and is oftentimes a voice for us and to raise the conditions and concerns of our public. All right, I'll turn it back over to you.
I've muted myself. And I'm going to turn it back. I'm going to turn it over to Joy.
Okay, thank you. So actually, we have a question here in the chat that this might be a good place to address it. I believe it was, okay, now I've lost that window. Arnessa, she asked if, let me find it, if there are currently any Black, Native, or other POC board members currently. And I believe the answer is yes, right?
Yes.
I'm new to this job, so I want to make sure I'm not missing anyone.
I saw the question in chat, and the BIPOC members, current members of the Board of Health that I would name off the cuff are Teresa Mosqueda and Tammy Morales, who both serve by virtue of being members of the Seattle City Council. We're changing our makeup, but currently there are 3 county council members, 3 City of Seattle members, and 2 voting and 2 alternate members from the Sound Cities Association, which are the unincorporated, the other cities other than Seattle around King County. And amongst those 4, Janice Zahn is a Bellevue City Council member who serves on the Board of Health. So there are 3 BIPOC members. And by virtue of the legislation the state has enacted asking us to reconstitute the board, it will call on us and specifically have us have more BIPOC voices and representation at the table, which I welcome and look forward to.
And I think at least one of our health professionals is BIPOC as well. Is that right?
Yes,
Board Member DeCastro.
indeed. Yes.
But we definitely are looking for as much representation as possible. So yes, as Chair McDermott mentioned, we have a mix right now on the board of 3 King County Council members, 3 from Seattle, 2 elected officials from cities other than Seattle, and then 3 health professionals. But what we're working towards this summer and fall is expanding the board, looking for people who would be interested in serving starting in 2023 in January. So we're going from 8, the current makeup of the board to an equal number of elected and non-elected representatives on the board starting next year. So the way that breaks down would be 1 tribal representative who will be appointed by the, okay, now I didn't write that down. I don't have it in front of me, but there's another group that's going to be appointing the tribal representative. 7 members drawn from public health professionals, healthcare professionals, those who represent health facilities, consumers of public health, or other stakeholders. Then alternates also for those groups. So the folks that we're focusing on recruiting today that we're talking about are these 7 members that are drawn from these groups listed here on this slide. So if you look at the application, which is posted on the website, you'll see there's 3 boxes that you can check, and please check all that apply because you very well might fit into more than one category. And so we'd love to be as to know as much about you about which category you might fit in. Next slide, please. Right, so as I said, we're looking for 10 people total, 7 members and 3 alternates who represent these categories. And just to be clear, so a member is someone who has voting authority, and an alternate is someone who can fill in for that person if the member is not available, and who can vote if that member is not available. And all members and alternates are invited to participate in all meetings. Can we go to the next slide, please? Member responsibilities include, but are not limited to, attending and participating in the monthly meetings, which are always held on the 3rd Thursday of the month at 1 o'clock. And the first one that these new board members would be participating in starts on January 20th, 2023. These meetings will be a hybrid mix of in-person and remote via Zoom for the foreseeable future. And I think that will continue into 2023 as far as we know. Non-elected members shall have the ability to vote except for on legislation pertaining to fees. So if you're a member of the board, but you're not an elected official, you would not vote on anything that related to fees. And then we ask that members participate in subcommittees as needed. Next slide. If your current employer does not already compensate you for participating on the board, then board members will be paid $225 for each full board meeting that they attend. So that's $225 a month. An example of someone who is already compensated, for example, like if you're a doctor working at the University of Washington and they're covering your salary, you know, whether or not you're at a board meeting or not, they would not be getting this compensation. But if you're a community member, your employer is not paying for you to be on the Board of Health, then we will compensate you. Next slide. And I just want to pause for a moment. Are there any questions in the Q&A? Let's see.
Joy, there's one question in the chat box and not the Q&A from Elise Chayette.
Okay, let me go to that and see if I can see it. Is this change a response to the new state requirement regarding local boards of health? Yes, this is. Last year, the state legislature did pass a law saying that boards of health all across the state should have equal representation on their boards between elected officials and non-elected officials. And that is indeed why we're making this change. And it's a welcome change.
Joy, and forgive me for the interruption, there's also a hand raised from Claudia.
Sorry, can you say that again?
There is also a hand raised from Claudia, our interpreter,
Oh, okay.
for the question.
Let me see. Okay, I'm not seeing that question.
Claudia, if you had a question, did you want to verbalize it with the group here?
Oh, I
No.
see.
No worries, thank you.
Okay, thank you. So applications are due June 30th. The board will review applications this summer, and we will probably be doing interviews in July and August. Applicants the board plans to move forward with will be invited to the September board meeting for introductions and interviews. Then the board will pass a resolution at the October meeting with recommendations for board members to the King County Council. And the King County Council will formally appoint members before the end of the year to start serving in 2023. And just a reminder, the applications and all information is posted on our website, which is kingcounty.gov/BOH for Board of Health. And I'm ready for the next slide. And that's it. So we just love to hear any questions that anyone has or comments.
Joy, I might respond to a question that was in chat as you were presenting. And first of all, further elaborate, Gurmai Zahalai, my colleague on the King County Council, and Robin Naroon, who we just appointed to the board at our meeting this week, are additional BIPOC members of the current Board of Health. Another question had to do with why we were making this change. And that's a great question. What the question was, is it particularly because of the state legislation, or are there other factors at play? And honestly, it's because of the state legislation, the requirement to do so. And at the same time, while it's taking up some bandwidth and work of the board, I welcome it because having non-elected and particularly consumers and other health professionals and BIPOC voices will add to the diversity and the quality of the work and the conversation we can do at the board. And the Native American seat is appointed by the American Indian Health Commission. They are responsible for making one appointment to each Board of Health around the state per the state legislation.
Thank you. I had a brain freeze on that one.
No worries.
Oh, there's a question about, is there a work plan that has been developed for 22-23 for the Board of Health? And if so, can you share the issues to be addressed?
There is not yet a work plan developed. The board adopts an annual work plan the beginning of each year. So you can find on our website and Joy, I know it would be buried in our meeting materials, but we might want to elevate it on the website. You can find the work plan for 2022, but we don't have one, but that's adopted for just this calendar year at this point in time. And as you review that, you will see it might be a little shorter than usual because the reconstitution of the board, this work we're doing now, is a undertaking for all of us, and recognizing that we'll be shifting membership.
Yeah, I can take a look at that next week and see if it's easy to find the 2022 work plan. Let's see. Not seeing any other questions right now.
Joy,
Good
do you
afternoon, everybody. Joy, we have some questions in the Q&A. I see 3 questions in the Q&A right now. And good afternoon, everybody. My name is Lon Nguyen. I'm a staff with Board Chair McDermott. So thanks for joining. The first question is, could you discuss some of the challenges we face in King County with regard to social determinants of health and how the board is approaching these challenges?
I'd be happy to take the first crack at that question, and I would welcome Dennis and Matthias if he'd like to offer any additional insights. King County has some of the highest health outcomes of counties across the country, but we also have some of the greatest disparities within our county. And it's those kind of social determinants of health that we're trying to address. And it can be frustrating because we don't always have the direct authority for the issues we might identify. For instance, we had a presentation earlier last year, I guess, regarding the impacts of living near airports. And while it's good for members of the board to have that information, we don't have any authority over King County International Airport or SeaTac Airport, from noise to air quality to particulates. So while having that information is important, we don't always have the authority to respond and take action. But again, that's where we can use some of the advocacy that we spoke of earlier in sharing those insights or the information we gather as the Board of Health, and informed by our work with the department of the health effects of decisions other people are making. Dennis, Matthias, do you want to add anything there?
Yeah, I can start, and Matthias, please pipe in with some of your work. You do a lot of work in this particular area with your team. For those who are a little bit less familiar with public health, we have a variety of programs that we do. And again, we have kind of 3 functions, which we say are our roles in public health. Our primary function, one of our primary functions, is really to look at the health data of the community. We look at population health. So what that really means is, when you look at, if you were going to your doctor's office, it would be work being done with you directly about your individual health. But we kind of do that more at a population level, and we look at the data we collect data, and we look at that across the entire county, and to see what the population's health is. And if there are areas where we see either disparities of health, as Joe mentioned, we have some of the best health outcomes in King County, but with that, we also have some of the greatest health disparities in King County. And so trying to close those disparities is our areas of focus. So a good example, I'll give you a couple good examples in how these 2 things intersect. A current issue, of course, right now that we are really concerned from a public health perspective is really around overdose deaths in King County. Those have been rising because of drug use and fentanyl in our community. So we do a lot of data collection on that to better understand what the problem is, and then look at both at policies or system changes that we want to really shift into different places. Some of those things may be determinants of health, like access to healthcare. It could be housing, stable housing. It could be It could be good, access to good quality jobs, access to food, a variety of things that we call social determinants of health. We oftentimes partner with other agencies who provide those services so that we can kind of take a whole health approach to the work we are trying to respond to in the middle of a crisis with overdose deaths. Same thing as we do provide direct healthcare services to people who are living unhoused. We do that with a number of partners in our community. And of course, we know that there are many social determinants of health that impact that: stable housing, education, access to education, and a variety of other things. And again, we work with our partners in the community to address those. We may not do them all exclusively within public health, but we do that with our variety of partners that we work with across the county in like DCHS, our Department of Health and Human Services, or community-based organizations. And part of getting to those solutions, again, is really the partnership with our community and understanding the voice and the lived experience of our community, and make sure that we're getting to the right outcome that we need and the right fix. So Matthias, what would you add?
Well, I think y'all have covered it quite well. I mean, I think also as part of this work, we do try to focus and not come to it from an institution angle, but really from community angle. People really, if you think holistically about people's health, we have to think about the social determinants of health. There are a lot of programs that we have and within the department as well, such as around not just infectious diseases, but around food access and things that are key determinants. And I think, as Dennis was just saying, we also work with other departments and other organizations to be able to push and make the changes that are needed in other areas as well. We even try to think about bringing a public health approach to things, even as things like the criminal legal system as well, which is extremely important. So we try to think holistically and really bring the community voice to places. And that's how we tend to do the work in public health, and bring those angles to other issues as well, that sometimes people don't think of them as public health issues. But by declaring racism a public health crisis, it means we need to think about things such as the criminal legal system from a root cause perspective, and what are the conditions in communities, right? Access to transportation, access to food, access to good education, those kinds of things that are really driving the outcomes.
Thank you. We have another question. We have a couple of questions in the Q&A. Diego asked, could one of you say a bit about that other stakeholder category? And just a reminder, there's 3 categories that we're recruiting from. One is public health, healthcare facilities and providers. The second one is consumers of public health. And the third is other community stakeholders. Chair McDermott, would you like to say something about that? Or
I'd be happy to. Marielle, did I see the, or were you just moving the question?
I just moved the question since we're answering it live.
All right. Okay. I think other is intended to be a broad category representing that all of us in the county are impacted by public health issues and our care and concern for one another, and their need and a opening for voices from throughout the community. And in fact, I tie this into the next question. Someone who works for a financial institution in our region with no experience in healthcare, and they go on to say they're passionate about equity and inclusion, as well as racism in our state and nation, and it identifies as a Black woman. Would they be considered a community stakeholder? I would say yes, without reservation. The membership of the board will be more inclusive of the community and categories, but also making sure that there are voices for without expertise.
because you have expertise in other areas that we'd love to benefit from. The next question is, has the Board of Health reviewed and/or commented on the state's Medicaid waiver renewal? If so, what issues were highlighted?
And we have not. Most of the advocacy work we have done is recently over the last 2 years in the legislature is in one broad category, if you will, supporting legislation for both medical schools and nursing schools and healthcare professionals to broaden the profession and be more inclusive of BIPOC and more diverse practitioners and providers.
And I just want to note that the categories that we're recruiting from were categories that were set by the state. And so we're going with those, but they're fairly broad. See, I'm not seeing any other questions right now. Okay, here's a question. Is the Medicaid waiver an area that would fall within the scope of the Board of Health?
It would not be within our direct decision-making influence, but like some of the other issues I've spoken of, it would be something the board could choose to take an advocacy role around and express our opinion, educate and develop common understanding within the board, and then it would be within our authority and reasonable for the board to learn and then advocate on the issue, but it's not one that we ourselves would have a role in.
Okay, I don't see any other questions right now. So I'm just going to ask a question of you, Chair McDermott. What do you get excited about with working with the Board of Health and chairing?
You know, when I left, I spent a decade in the legislature and came to the council just over a decade ago, as I said. And my work in Olympia had been more around education, but a particular piece of legislation I ran in Olympia was to ban smoking in all indoor public places, recognizing the effects of secondhand smoke on those who are choosing not to smoke. And at the time, we didn't have a ban in all indoor public places. There were we had bans for office places, workplaces for many people, but not for restaurants, bars, and taverns in particular, which are where low-wage people work and where people may not have as much flexibility to make other choices. And I was proud to run legislation to eliminate that loophole, if you will, and ban smoking in all indoor public places with no exemption. It ultimately didn't pass as legislation, was later adopted by the people as an initiative. But that was one of my key early formal involvements in public health as far as being in a legislative role, and the ability to serve on the Board of Health and direct and support that kind of community health is really valuable to me. And I spoke to the history of this board in doing some really progressive public health work from the time, frankly, from years ago when I was interning for my then King County Council member, the job I now hold. I watched the Board of Health then ban the Marlboro Man cigarette advertising from the Kingdom, and have watched the board continue that work over the years, and I'm proud to be able to be a part of it, in some cases lead that work, particularly around safe and secure medicine return programs.
Thank you. We have another question. Approximately how many applicants are you expecting or that you've seen thus far? I can answer that. We've gotten 10 applications so far. And I would say, well, we don't really know how many we're expecting, but we're really hoping to get a number of applications from just a wide variety of folks around King County.
We have established we've mentioned that the board has subcommittees and members are asked to serve on subcommittees as they're established and created and have a body of work. We don't have standing ongoing subcommittees, but we create them for specific tasks within our work. And we have created a subcommittee around this work to review applications and make recommendations to the larger board. So it is something we've set some infrastructure and time around, both in establishing a subcommittee and as I said, being a prominent piece of our work plan for this year.
Thank you. And Matthias, one of your jobs is you work very deeply with community. Can you maybe say something about what you're hoping to see from an expanded board and how the voice of community might come through those board members?
Yeah, I mean, I think this is an extremely important move that the Board of Health is making. One of the letters I mentioned at the very beginning came from the Community Health Board Coalition. Very strong advocate representing about 15 different ethnic boards. Already, the first edition that has been added already this year, Council Member McDermott mentioned Robin Arun, who's from one of those health boards, is from the Pacific Islander community, and has been really, during the pandemic, for example, pushing us as public health, Salcombe County, in really powerful ways to be more responsive and actually provide better services and have a more effective pandemic response, and putting testing sites where we need to be putting them, doing vaccine delivery in equitable ways. So we've been seeing the powerful voice from community and how important it is to involve them in our policy development, decision making, and it makes a difference actually in terms of not just what we put out then as policy, but then how our actions and the implementation of those. So I think that to see this happening, I think at the Board of Health is just very inspiring. I mean, I think it's going to create a board that is more representative and responsive of community, and it's going to create a much stronger board that's more representative of the communities that we are serving. I have nothing but excitement about this, some of the new changes that are happening.
Thank you. Dennis, maybe you could say a couple words about how the board and community voices influence your work as director.
Yeah, thanks, Joy. Great question. Yeah, I think the thing I would offer is we've got a number, we've been so focused the past couple of years in COVID, and we have built some really wonderful work groups that have really that have represented the community, are voiced from the community, that have really helped shape our response in COVID. We need to take that practice and look at some of the other leading causes of death or premature, disabilities or other challenges that are happening in our health of our community, and carry that model over. So I like Matthias, I agree that by having more representative board will be one avenue of doing that. Also doing that internally in our commitment to as a department will be really incredible. I talked about our functions in public health, from data collection to really programs and policies, and really assuring people have access to good health care, and that our programs are reaching all people. And we take what we call a targeted universalism approach, is we really set a standard of what we want to see the health of our community to be, and then we develop strategies by working with community where we see those health disparities, or where we see poor health outcomes in particular communities, where we want to really bring them to the target that we have set for all people within King County. So getting more experience, getting more voice, getting more lived experience into those conversations, whether that's about telling the story about the data, or the right policy that will work, or the right program that's going to be effective to getting to those health outcomes, is going to be critically important. So a good lesson learned in COVID, a good lesson learned in several parts of our public health practice, and only getting more committed to that as we move in the Board of Health direction, but also as a department.
Thank you. We have a few more questions. The first one is, Has the Board of Health and or Health Department documented lessons learned from COVID, both in terms of what is needed in the surveillance tools for public health and or in the continuum of care within our healthcare delivery system, particularly in the nexus of health and housing? And that is in the Q&A if you want to read that again. It was, how has the Board of Health and or the department documented lessons learned from COVID?
Yeah, I can start with that through, hi, Elise. I know Elise very well. Thanks for the question. We, of course, as you know, the public health practice, working with our preparedness sections and working with other bodies, we have been doing after actions actually for a while, because this has been such an incredibly long response with COVID. We have been doing iterations of this throughout the response to make sure that we are capturing as close to real time as we can of what we're learning, what were some of our deficits, and what has been some of the innovation that we have been able to put in place that we want to sustain as our ongoing forward, or where we need to correct. Data has certainly been one of those things. We have challenges. This is a more complicated answer, but we have challenges with data because not all of our systems talk to each other. And so working across the Department of Health, working across other local health jurisdictions and healthcare systems in order to be able to improve that data. Of course, working as in one segment I think to the question you ask is looking at the continuum of care, in particular for those really with who have lived unhoused in our community, working with the King County Regional Health Authority, the City of Seattle, other local jurisdictions, and the county governments to improve those practices. Because I think what really has been highlighted through COVID is things we've known, but even came to more light around our inequities and in communities. And of course, where we have not built resilience where we need to, of course, those really poor outcomes around COVID certainly showed up, and it just reiterated our commitment to those areas through our after actions. And we'll continue to do those after actions. We have consultants working with us, as well as a variety of public health systems, both nationally and statewide and locally.
Thank you.
I would add, sitting as a member of the Board of Health and a member of the County Council and a former legislator, this is also drawn out for me more practically something I was honestly already aware of, and that is a lack of funding and ongoing funding for public health. The legislature has stepped up and made some investments in foundational public health funding, really the basic operations of public health without a crisis being involved just before the pandemic. But public health has been chronically underfunded. This is one of those things where if I knew now if I knew then as a legislator what I know now as a member of the Board of Health, I would have done harder work in this area in Olympia when I was in the legislature. We rely on the state for a lot of direct funding for public health and for disease prevention and tracking, that those resources will be invaluable to be able to do the work we would identify coming out of the pandemic.
Thank you. We have another question. What role, if any, is public health playing in the infant formula shortage crisis?
Yeah, I can start that. Well, first of all, I just want to say, for those who don't know, council member and our Board of Health Chair, Joe McDermott, he has been a strong advocate for funding for quite some time. So I know you would have done more, but you have been one of our big champions in that area. We have received funding through what's called Foundational Public Health. It's been a 10-year process to get funded. We're still not where we want to be, but Councilmember McDermott has been one of our key advocates in that particular area. So compliments to him in that area. Around the baby formula, yes, I'll start with yes, and then I'll say to expand on that a little bit. When we talk about public health, there are different layers of public health. We have the federal public health that oftentimes people will hear as the CDC, as our federal agency of the Public Health Department, the Center for Disease Control. And then we have a local, we have a state public health department that is operated out of the state. And then, of course, we have a local health department here in King County, and that's what we represent as a collective here. And in the state of Washington, we have what's called a decentralized public health system. Most of the authorities are at the local level. And but when it comes to things like formula, there is primary work really trying to close down the shortage, produced more law, or getting people to create more, making new formula and really getting at us. I think most of you know that there was a contamination to the formula back in February. Many of them were pulled, and we've never been able to get caught up. And so we don't have a role necessarily in that, but certainly our federal and our state partners in public health are doing that work. What we are doing here locally, we have a couple of programs that are called maternal child health that really work with new moms, babies. And we have another program called WIC, it's Women in Infant and Children's. And it's really around the nutrition of moms and babies. And we've been working very closely with our clients who are who receive services from public health. And if formula is one of the things they're receiving, and they get a coupon or a voucher in order to buy that formula, if the formula voucher that they received is not available, we work with them to make sure they get a voucher to get the formula that they need, and help resolve those problems. We are also providing formula directly to parents, moms and families for their babies that we do have here that comes through the federal government to us here locally. And of course, we're advocating with the state health department federally for the procurement and of course the reproduction of more formula here. So we kind of play a direct role with moms who need it, and babies who need it, and helping to cover those barriers. But we are also working in the advocacy side of getting more production and looking overseas to buy more formula to come in to help offset the need.
Thank you. I'm not seeing any other questions right now. We could pause for a moment and see if anyone else has any questions. Please put them in the Q&A or raise your hand. We'd love to be able to answer any other questions you might still have. And again, you can visit our website at kingcounty.gov/BOH for more information and for the application to join the board. And there you'll also find an email address that you can send any questions to. That's kcbohadmin@kingcounty.gov. And I also put that email address and the web address in the chat. I'm not seeing any other questions right now. Well, anything any of you would like to say in closing?
I would thank everybody for joining us, spending part of your Saturday afternoon hearing about the Board of Health, our work, how we do our work, and the new membership and the new form we will take in the new year. I hope after the discussion, you're at least as interested, if not perhaps even more, about joining us and bringing your knowledge, your experience in the community, and your expertise to us, and supporting the people of King County as we try to meet people's needs and support people in their full potential and opportunity. I encourage you also to share the link and the website and knowledge of our work in member recruitment with anyone else you may know in the community who may have an interest in serving, and would also take a minute to thank Joy and Lon and people throughout public health for the staff work it took to put together today's open house and our work here. And I want to encourage anybody to reach out to the formal website and email address that's been shared in chat, or with me, or I'll be bold enough to suggest anyone else part of the workshop today with any individual questions you'd like to follow up as you consider and put together your application materials.
Thank you. And I would really like to say thank you to our interpreters, Cheryl, Jai, Catherine, Etienne, and Claudia. Thank you very much for helping out. And Matthias, you've got your hand raised.
I'm sorry, I was trying to do the clap.
Okay, well, thank you very much. And I think this will bring us to the end of our open house. Thanks for joining us. And please, again, visit us on our website, kingcounty.gov/BOH.
All right, thank you all.
Thank you.
Thanks so much, everyone.
Thank you.
Thank you.